Okay, so what exactly is happening in Kenya? Why are health workers, frontline workers, unwilling to take that vaccine, so to speak, if you go by that story by Sada Hassan? I'd like to speak to Dr. Willis Akhwale, Covid-19 Task Force Advisory Chair. He's here in studio with me. Sir, good evening. Thank you for speaking to us on Checkpoint this evening.
Okay, thank you, Linda.
So we're looking at slightly above 10,000. Is that a pace that you'd say is commendable? What's going on?
Absolutely commendable.
Out of 1.2 vaccines?
I will say that absolutely commendable. The vaccines arrived here, if you remember, on the 3rd in the morning. The next day we started distributing them, and by Saturday the 5th, even the farthest county, Mandera, had got the vaccine. Okay. The week of 8th was our week 1. Counties started drawing the vaccine from regional stores to the counties. Many counties started the vaccination on Wednesday and Thursday of last week. The reason being, you have to put in the structure. The people who are trained, first you have to go and collect the vaccines, then you have to start. By Friday, by Wednesday, 23 counties began. By Friday, 43, but 40 counties reported into our system. You are basically talking of 2 to 3 days and vaccinated 10,000.
So 2 to 3 days with 10,000 is acceptable?
For a start. Remember, we began with 47 vaccination posts. From this week, we are scaling this up to 622 to cover the period up to June. What Kenyans need to know, our phase 1 goes up to June. We are not in a hurry. We have to do things right. This is not an exercise that we are looking for numbers. And this advice, my task force has really said, quality monitoring, which I'll come to, very, very key. You have to get it right. People must be trained. We would rather go slow and get everything right. And this is why we started with really for 1 post per county. And now from next week, we have identified the 622 posts. We worked with the county. They are the ones who gave us those lists. They will only be opened upon healthcare workers being trained and upon their ability to report in the digital platform we are calling Chanjo Kenya, because we must track every vaccine so that if there's a side effect, we know who, where, which batch. I'll
come back to that side effect. Wouldn't you say it's contradictory when you say we are not in a hurry? We have a global pandemic that everyone is trying to control. So when you say you're not in a hurry?
In a hurry. Now, if you look at our plan, we are supposed to vaccinate 1.25 million people up to June. Now, then what you need to know, how many doses do we have? And you must know there has to be 2 doses per person.
Yes.
So we are going to vaccinate 1 million people, and after 8 weeks, the next doses will then come, and we give them the second doses. So for me, even at that pace of week 1, and we are scaling up, we are going to be doing anything between 15,000. If you really look at 600 facilities are working.
Over 600, 622.
Yes. Once we start doing that, it is going to be. Now, from 47, you can imagine by the time we triple, quadruple, it is going to be massive. But in the first week, there are a lot of logistical things that you have to be very sure everything is in place. And you are talking of 3 days. So 10,000, number 1, we monitored side effects. There was no serious side effects. Any science will tell you 10,000 is a big sample. If there was anything serious, which we were monitoring, a very key thing to do during the first week, there was no serious side effect.
It's interesting that you're saying there's no serious side effect. There are several countries that have recalled or stopped using AstraZeneca. And perhaps when you speak to some of the healthcare workers, they say, and in fact, when you watch that story by Sada, some of them are saying, we are not sure what to expect with this vaccine. What are these concerns, and could you demystify them for our viewers?
Yes, you've used 2 words which are not. No recall has been done, no stoppage has been done. What we are dealing with is suspension. So, and I'll explain also here what happens globally and what we are going to do in Kenya.
Go ahead.
So, when you are deploying a health product for the very first time to a huge population, you must set up a robust surveillance system. You will have to report on what you call common side effects, which may have been seen during clinical trial to phase 3. And you must start looking for rare side effects, if any. But what is more important, you must link the side effect to have been caused by the vaccine. That is when you suspend and do that investigation.
Okay.
Now, if no linkage is found, you continue. It is a regulatory requirement for licensor. If you don't do that, then your product will never be licensed. So it is something that is required of the manufacturers, and under emergency use like now, the government are supporting this, this particular process. So it is when, and it's good that you also tell people how many countries stopped and have restarted. Canada, Spain, Belgium, is because they do investigation.
And
let me say, today the International Association of the top physicians dealing with thrombosis actually have said there is no causality, meaning nothing about that vaccine is causing the thrombosis.
Okay.
And the European Medicines Agency has also said that. But out of safety, out of concern, you are required as both the manufacturer and in this case the government that they set up that system that is able to report, so that this is what forms the dossier for full market authorization.
Okay. So let's take a step back, because this is very important for Kenyans. There is, from what you've said, there is zero correlation between the vaccine and the blood clots.
This is as per the International Association of the Physicians who deal with thrombosis. Okay. It's public. We can share that. I think it was released today after midday.
Yeah, that would ease a lot of anxiety.
And it should, it should. Because even when you do phase 3 trials, thrombosis with AstraZeneca was not one of these. But when you start rolling out, when you hear a report out of safety, you are supposed to investigate it. Now, let me say, there are people with thrombosis in Kenya even today. There is somebody who will develop a clot next week. He may by chance be injected today, but he was going to have a clot next week anyway.
Yeah.
So that is why an independent safety, we will look at his history, we look at several things, and we may find that this is somebody who had thrombosis anyway, even before vaccination. So that causality, which means it is the vaccine that caused the thrombosis, that has not been established anywhere in the world with AstraZeneca.
Okay, so we started vaccinating last week, right?
Yes.
We are heading into a new week. How long do you have before you start looking at the people who've been vaccinated for side effects? Is there a process?
Absolutely, and let me tell Kenyans we want side effects reported. So we started with what we call a passive reporting of the side effects, meaning that the healthcare workers are telling the people, when you go and you feel anything, kindly report. If it is a headache, if it is pain.
Have you been vaccinated, by the way?
I was vaccinated on Tuesday. I only felt an heavy arm later that evening. Yeah. And the next day I was as fit as a fiddle. Really, I can't even imagine I got that vaccine.
Yeah.
But let me say the other thing, and this is what we were putting in place last week, is now going to be active surveillance of the side effects. Okay. So the pharmacy board, the manufacturers, and the Ministry of Health are forming teams that will go randomly across the country to start looking if there can be any cause, anything that is reported. And we're encouraging people, if you feel after vaccination there is something that is so severe you need to report, let them report. You go to your healthcare worker, there are particular forms. These forms are filled, and they are transmitted to the Pharmacy and Poisons Board. That is crucial for us, because it will also give us a profile of how the vaccine is working. However, let Kenyans know, this particular vaccine has been used in Kenya even before this registration. Down in Kilifi, studies started a long time ago. Ask the people in Kilifi if there's anything they found to do with thrombosis. So I really want to assure Kenyans, first and foremost, and that's why I told you, don't look the pace in terms of numbers. Look at the quality. Like now, that robust system that we are really setting, that will allow you to report. By the way, even if you feel it is so much of a pain, we want you to go and get that form filled.
Even if it's just pain?
Yes, because this is what we are going to say is happening with the vaccine.
Okay.
If it is the headache is so severe, we won't.
Come and tell us the headache is severe, I cannot deal with this.
Yes.
Okay, listen, Daktari, before we wrap this up, Dr. Githinji Gitahi tweeted something, and it was with respect to the ICU beds that are currently occupied in Kenya. He said about close to 25% of all ICU beds are occupied by COVID patients. As we look at that tweet by Daktari, I want you to look at the positivity rate in Kenya right now and explain to Kenyans where we are in terms of fighting the COVID-19 vaccine. How badly off are we, or what strides are we making?
So obviously, coronavirus disease is a global pandemic. It has had serious socioeconomic impact. It has caused deaths. Nearly 2,000 people have died now. Many have been diagnosed positive. Coronavirus kills. What the vaccine is doing, all these vaccines are doing, is to stop progression to severe disease. If you are vaccinated, the chance of severe disease is minimized. Chances of, therefore, hospital admission and death. This is what the vaccine stops.
Okay, wait. So you can get vaccinated and you'll still get the virus, but it will not be as severe?
Absolutely.
Okay, which is a good thing. So
which is a good thing.
Yeah.
But that is exactly what it's doing. But a country like Israel that has now gone and vaccinated a wider population, they have started seeing that also transmission is reducing.
So that works to advantage. Where's your camera? I want you to look at that camera and just speak to Kenyans and healthcare workers who are hesitant about taking this vaccine and why it's important for us to have a global fight against this COVID-19 virus. Go.
Now, the issue about hesitancy, let me actually say, first and foremost, we are not forcing anybody. The vaccination is voluntary. Ours and the Ministry of Health is to give you information, you make a formed decision. Don't be sorry at the time when things may go bad. We tell you and you make that particular decision. One thing people should understand that these vaccines, the safety and effectiveness, you do not get emergency use authorization before safety and effectiveness is assessed. And the other thing, the word you should look for is revocation, not stoppage. If emergency use authorization, if there will be any linkage to serious adverse effects, then you will hear that WHO has revoked and not suspended.
And so far?
And so far, there has been no revocation. So, for me, healthcare workers, you are on the front line. The variants are changing. We lost many healthcare workers last year. You have an opportunity as a front line. The government has prioritized your protection. Take advantage of this. But let me also say, there could be hesitancy on social media, but last week when I toured Mbagathi, Kenyatta, and Mutuini, the healthcare workers turned in large numbers. And I have evidence for that.
Okay, that's the perfect place to end this conversation, but roughly in 30 seconds, do you think it would have made a difference if someone like the health CS, Mutahi Kagwe, and President Uhuru Kenyatta led in this drive, perhaps take their vaccines in the full glare of the cameras? Perhaps would that have changed anything?
Something Kenyans should know, the vaccines are just not there. The factories, the manufacturing, it's a big challenge. Okay. In fact, if you go to the COVAX, you realize we were to get 4.1, now we've been told what is available is 3.5, and we don't know, it could keep reducing because more countries are coming. So we decided to prioritize healthcare workers, security forces, and the teachers. Okay. Very critical. So politicians, my cabinet secretary, their turn will come. The cabinet secretary said yesterday, when we call him, he will come.
All right. Thank you so much, Dr. Willis Ahwale, COVID-19 Vaccine Advisory Chair. Thank you for speaking to us on Checkpoint. And we thank you for staying with us. We're taking our fast break. When we come back, we'll look at that back and forth, the tussle between Kenya and Somalia and what it means, because Kenya seems